My name is Rachel Cady. I'm an obstetrician gynecologist. I work at Cady Regional Medical Center in Crosby, Minnesota, and I've been in practice here for about 14 years. So Interstim is a type of what we call sacroneuromodulation, which is a big term for a procedure that actually alters the nerve input into the bladder and or rectum for cases related to refractory or situations where the patient is not getting better with profound urgency, frequency of bladder urination, in some cases urinary retention, and also for fecal incontinence. This is FDA approved for all three of those indications and has been FDA approved since 1997. People that are good candidates for Interstim are patients that have had either, again, incontinence of bowel that has not been relieved with conservative management, dietary changes, medications, and have had a proper evaluation. Those patients are, in general, very good candidates for Interstim placement. The other two indications, as I talked about, is for urinary retention, where there's not something obstructing the opening to the bladder, the urethra, but patients are just having a really hard time emptying their bladder. This Interstim is also a good treatment modality for a lot of those patients. And then finally, for patients that find themselves constantly needing to go to the bathroom, urgency and frequency, sort of feeling chained to the toilet, if you will, that gotta go, with or without leaking associated with that. And again, who have not responded well to other first and second line treatments, such as behavioral modifications, dietary changes, making sure that their medications aren't causing bladder side effects, physical therapy, different medications. And for those patients, which is a great portion of the population, Interstim is oftentimes a really good treatment option for them. And so what's appealing about Interstim is basically it's the idea behind it is that the nerve stimulation to the bladder, the pelvic floor, vaginal area, and the rectum comes from the sacral nerves, S2, 3, 4. And those are nerves that come off of the spinal cord, lower down on the spinal cord, not the actual spinal cord itself, but that provides the nerve input to the pelvic floor area and those organs. And so the thought process is that in a lot of these cases, there's an over nerve stimulation to the organ. And so when we alter that nerve stimulation and down regulate that nerve supply, which is what the Interstim device does, that people get relief of the problems that I just mentioned, whether it be bladder or bowel. And so the actual process itself is it's a same day surgery. The patient is sedated. They're not needed to be completely put under, but they're sedated. And we place this lead wire, electrical lead, near the S3 nerve. And we use an X-ray type machine in surgery. Patient is very comfortable. We're talking with them, but again, they're sedated. And we look for the proper placement depending on the sensation that we're stimulating with this lead. And then we place a battery externally, like on a belt, and the patient wears that for about a week. It's kind of a test to see if they're going to be a good candidate for this implant. And we have them log their symptoms for the few days, or ideally up to about a week, to see if there is at least a 50% improvement in their symptoms, which is the case the majority of the time. And so if they have a good test result, we bring them back for about a 5-minute procedure where we're actually placing the battery. And the battery goes in the upper outer buttock, about an inch under the skin. Again, they're sedated for that. And it's a battery that's about 1.5 inches in size by 1.5 inches, kind of like a pacemaker, if you will. And that battery usually lasts for about 5 years. And at the end of 5 years, all that's needed is to replace the battery itself. So there really isn't any downtime from work for either the test or for the battery placement itself. So a nice minimally invasive option for people that just are really pretty miserable with these common problems. For bowel symptoms, it's over 90% effective. Again, this would be for bowel incontinence. For bladder symptoms, it's about 70% effective. And this is really good long-term data, again, having been out for just a little bit over 20 years with FDA approval. But again, these are patients that are refractory patients. I mean, they have not responded to traditional treatment options. And so these are actually really pretty good numbers for a really low risk procedure. By the time a patient comes to see us, in a lot of cases, they've already tried certain things, or they've had a cystoscopy, seen other clinicians, tried other medications, tried other things for their bladder. And so in those cases, sometimes Interstim is the automatic next first thing to offer when we see them. In other cases, certainly if they haven't tried anything else, this would not be considered a first-line treatment option, but is definitely in the array of treatment options for patients when they have not responded to more conservative measures. The best way to get an appointment with us is to either self-refer, call our office here at CRMC, or to have a consult placed by their primary care clinician.